Epilepsy is one of the most common neurological disorders all over the world, and it affects about 50 million people all over the world. In our country, India, there are 6 to 8 million active epileptic patients, most likely. It's common all over the states in India. In every state, the prevalence varies from 3 to 7.5 per thousand population, and there are two age groups which have maximum prevalence and incidence. That is younger age group, first and second decade, and also in 6th, 7th, and 8th decade. There are two peaks. One is elderly peak and another is a young peak. And the elderly peak is increasing over last decade, while the young peak is stable and static. In patients with epilepsy, they get unconscious, they can get frothing, they can get jerking, they get stiffness, and it remains for minutes, and then the recovery is spontaneous. Sometimes they may go into a status epilepticus. Sometimes there is only altered sensorium with changes in with some changes where even patient can again fall. It all depends on which part of the brain the epilepsy originates. There are a lot of reasons for epilepsy. There may be structural lesions in brain, there may be genetic reasons in brain, there may be metabolic reasons in brain, there may be birth traumas, birth hypoxias, and so many things can lead to epilepsies. And common cause of epilepsy in elderly is trauma and strokes. Strokes in elderly are the commonest cause of seizures. Tumors can also produce intracranial tumors produce. But the most important thing about epilepsy is that we have treatment. The medical treatment has improved a lot in the last 30 years. Lot of drugs, new drugs have come which can make people seizure free. Up to 70 to 80% of the people can get seizure free with old and new drugs alone, and some 20% who have resistant seizures, many of them can improve with surgery, which is remarkably present in many parts of the country. And there are about 40 or more centers where epilepsy surgery is done in our country now, and the expertise and the technology is present, and many patients, thousands of patients in India have undergone neurosurgical management for chronic resistant epilepsies or lesional epilepsies due to lesions. The most important thing is, with good control of seizures, the person with seizures can have normal lifespan, can have normal working conditions, can live a normal life, can live with a family, can have their own families. Especially women with epilepsies who had a lot of issues relating to drugs with pregnancy can have better drugs now, and their pregnancy and their delivery becomes very normal and uneventful now with newer drugs which have come in the market, which are free of teratogenicity. Thank you so very much.